Dr. Mark Siegel is a member of the Fox News Medical A-Team, professor of medicine at NYU Langone Medical Center, with us now in studio, and good day to you.
Hi, Bill.
Doctor-patient relationship right now. There seems to be two apparent questions that keep coming back. Number one, how do you keep those insured who acquired insurance under the Affordable Care Act? How do you keep them insured? Is it possible?
All of America's patients want to know the answer to that. But let's keep in mind, 170 million people, Bill, are getting their insurance through their employer. And we're talking about 20 million new ones under Obamacare. 12 million of those have Medicaid expansion. They're going to get to keep it, for sure. The Medicaid expansion under President-elect Trump will stay, in my opinion, and it's been said by others. Second point, what about those 8 million? Well, Kellyanne Conway said yesterday, President-elect Trump has every intention of giving them insurance, not taking away insurance from someone that has it. Well, how do you do that? Well, you know what? The exchanges offer pseudo comprehensive insurance. What do I mean by that? You pay $350 a month, the government pays $250 a month, you're told you get bells and whistles, you get to the doctor's office like mine, you get squat. You can't get what you need. So let's offer those 8 million the kind of insurance that actually works in the doctor's office, that's scaled back, that isn't so regulated, that has more choice involved, and you'll have lower premiums, which is what we need. That's the first point.
The second question that keeps coming back, Republicans, Democrats, etc., is there any doubt that those with pre-existing conditions would be covered?
Not at all, and I predict Dr. Siegel's prescription today, I think it will be better.
Better?
Better. I think you're going to see high-risk pools in the states like you had before Obamacare was officially in place. And if I have a patient that has diabetes, let's say, currently under Obamacare, they may not get the medicine they need. They may not get the diabetologist they need. I may not be able to give them the specialist I want. But with a high-risk pool, and that's where the government subsidies belong. Heavily subsidized comprehensive insurance that gives me more flexibility as a doctor to help somebody with a chronic condition. That will be an improvement over the Obamacare. Less regulated, more bells and whistles, high-risk pools.
Okay, if they come out, we're going to go to this. But just one other thing. I feel like I'm in 2009 and 2010 all over again talking to you about this. Are you concerned with replacing it with something that is effective, as a doctor speaking to a physician?
Well, I think that's got to be what the focus is, Bill, but I'm not concerned about it because, as I've said already here, the current insurance isn't working. It's too expensive. There's too many regulations. You can't get the doctor you want. You can't get the care you need. You can't get the tests you want. We have to replace it with a kind of insurance that's more easily to work with and have doctors that participate in it. Because most doctors are opting out of Obamacare. And then you'll see malpractice reform. You're going to see a situation where doctors are happier and patients are happier. I think we're going to keep the pre-existing conditions, as you said, and we're going to keep people to stay on their parents' policy up to the age of 26. Those are going to stay. The parts that aren't working are the state exchanges and the individual and other mandates. Those have to go. What you're going to see in Congress now is those will go. You'll see the mandates go. You'll see the exchanges go. Exchanges will be in place for another couple of years, and then they will go.
Thank you, Dr. Mark Siegel here, trying to develop the next great health care system.
More choice, more competition.
We'll see if they do it. Thank you very much.